And so when we see someone that comes in and they show us their x-ray and like, what can you do for us? Because the doctor says, I just can do injections and I'm probably leading down to having surgery. And my comment initially would be like, well, I guarantee you that right at that level, there's probably a fulcrum. And that's where the back is bending. That's the only spot the back is bending. So it's kind of like if you have your spine and you're just bending at one level. And so if you're always bending at one level, it tends to shift it forward. And that's a problem. And so what we find is that the levels above the disc, the levels above it, are super stiff. And so we've got to get those moving. And the levels below it are also super stiff. Now we find this really common in the lower back. And so when we talk about the lower levels, we're also talking about the hips. Because if the hips don't move, the hip is in the ball and socket like this. If it doesn't move, it's going to take the back. Or if it doesn't move, it's going to take the back with it.